following is a production of West Virginia Public Broadcasting.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University. Welcome to Doctors on Call. Tonight's topic, prostate problems. Two experts are here to answer your questions. Now here's your host, Dr. Joe Prudhomme.
Good evening. It's natural for a man's prostate to get larger as he ages. If it gets too large, it can cause health problems. And while prostate cancer is very common, there are other non-cancerous conditions that may affect you as well. Bacterial infections, chronic pelvic pain syndrome, and BPH, benign prostatic hyperplasia, that can all cause urinary problems. What are the symptoms of prostate problems? How often should you get a PSA blood test? What are the latest treatment options for prostate cancer? We'll get the answers to those questions and more tonight from our two guests. Dr. Henry Fuchs, a urologist at WVU whose special interests include treating prostate cancer, voiding, and erectile dysfunction, and Dr. Mohammed Salkini, also a urologist at WVU whose special interests include treating prostate cancer with robotic surgery. If you'd like to ask our guests a question, give us a call. Our phone lines are open now. Henry, most men find themselves running to the bathroom more often as they age. Is that a sign of a problem?
That usually means that the prostate is enlarged, and about 50% of men as they get older, their prostates will enlarge and they can find themselves going to the bathroom very often. And we have medication today to treat patients.
What kind of problem is it that causes that?
Well, as men get older, the male sex hormone, testosterone, can cause the prostate to enlarge, and that can encroach upon the channel, and the man doesn't empty their bladder like they should.
Is this problem always serious?
It's varying degrees of severity. In some men it's very mild, in some men it's very severe where they need to have medication if they're going very often and perhaps getting up at night several times a night to go to the bathroom.
But it doesn't necessarily mean you have prostate cancer, does it, Mohammed? I understand a lot of people get prostate cancer. It's pretty common, but very few people die from it, even if it is cancerous. Is that right?
That's right. The problem is that prostate cancer doesn't develop into a fatal disease in all men. For example, a man has to live at least 10 years to die from prostate cancer. And prostate cancer is one of the few diseases that is still unpredictable in its behavior. Unpredictable.
How young can you be and get prostate cancer, Dr. Fuchs?
Well, the youngest patient that I've, in my practice, was 36 years old, and he had a positive family history. His grandfather had prostate cancer, and his PSA was elevated to 3.6, and on biopsy, he did have prostate cancer, but he had a good result in that he had radical surgery, and he was cured.
Is it worse if it comes on at an earlier age, usually?
Prostate cancer tend to be a little more aggressive in younger patients as opposed to older patients.
So tell me about screening. What's the routine screening recommendation for normal men and for men with a family history?
In men with a positive family history, they should begin screening at the age of 40, and other men should start at age 50. And African American men should start at age 40, even if they have no one in their family with prostate cancer.
Mohammed, what is the routine prostate screening? How often is it done, and what do you do?
We do it on an annual basis with a digital rectal exam, which should be done by their primary care doctor, and with PSA, which is a blood test that they can do every year.
Great. So, folks, give us some calls. Our phone lines are open. Please call in with your questions for Dr. Mohammed and for Dr. Fuchs, and we'll see if we can't find out if we can help some people out there. I am curious about one thing that you do, sir. Tell me about the robotic surgery. I'm really interested in that. I understand that that's a specialty of yours.
Yeah, one of the things that happened recently that the development of the robot, the Da Vinci, as they call it. What's nice about the robot is combined by the minimally invasive nature of the surgery and at the same time take care of their cancer. It cures cancer, and besides that, it is much more able to restore their functional life, like the sexual function and the continence. Using the robot, we were much able to preserve the sexual function. We were much more able to preserve their continence. And at the same time, we did not jeopardize the oncologic outcome of the prostate surgery.
So it works just as well, but a lot smaller chance of damaging the nerves that cause erectile dysfunction. Are the incisions also smaller? Does it hurt less? Is that an advantage?
The incisions are much smaller. Instead of having longitudinal big incision in their abdomen, the incision tend to be 5 to 6 small 1 centimeter incision where the robotic arm can be introduced along with the instrument. And besides that, the recovery is much faster. So the patient we discharge the patient within 24 hours to 48 hours, and they come back to their normal life within 2 to 4 weeks usually.
Excellent. Well, it sounds like a big improvement. Tell me a little bit, Dr. Fuchs, about erectile dysfunction. That's another problem for many men of the same age group.
It's estimated about 10 million men in the United States have erectile dysfunction, but only about 1/10 of those actually go in for treatment. And we have medication to treat erectile dysfunction today that we didn't have many years ago. And I find that most patients will respond to the medication.
Wonderful, wonderful. Is there anything that you'd like to add about that, sir? Tell me a little bit then about risk factors for the prostate cancer. That's one thing that I meant to hit, and I didn't mean to get away from that before we covered the risk factors. How should I know if I'm at high risk and need, other than the family history, need to be screened at 40, or if I have to wait until I'm 50 and then begin?
The Western diet actually has a lot to do with prostate cancer. Having high fatty acid in our meals, having low fiber and high protein diet are very well known to contribute to somehow to prostate cancer. But the most significant factor, as Dr. Fuchs said, that it is the family history.
Family history is number one. Well, I understand we have a caller on the line from Boyd County, Kentucky. David, please ask the gentleman your question.
Yes, I have a slight family history, and I was wondering, I'm 52 years old, and I currently have a PSA blood test every year, and I've seen it go up in the last 3 years to 0.2 of a point every year, but then the last year it went up 0.6, and then a follow-up exam, it went up another 0.5. I was wondering how much of a concern is that, and I was told that if it in fact was about a 4, then that was considered cancerous. I'm just wondering what you thought about that and what you should do.
And so what is it now?
It's about 2.5 now.
Well, for a man in his 50s, we don't like to see the PSA go over 3.5 in someone in their 50s. And if he has a positive family history, I would watch his PSA very closely. And if it started to approach around 3, in general, I would probably recommend a prostate biopsy.
Biopsy with the family history. All right. Well, thanks for that question, David. Tell me about the biopsy procedure. Mohammed, is that a big deal? Is that a...
It is an office procedure that we do under local anesthesia. It includes examining the prostate with ultrasound probes that we can introduce through the anus. And under the ultrasound guidance, we sample different location of the prostate, different region. We start from the top all the way to the bottom on each side. As everybody knows, the prostate is two loops, right and left. We sample the right and the left, and we send each sample alone to the pathology. So they look at it under the microscope, and they would decide what kind of tissue they find. And if they find a prostate cancer in that tissue, they give us like percentage how much of the biopsy is involved with cancer.
Got it. But it's still an outpatient, same-day kind of procedure,
It is
right?
outpatient, same-day procedure.
Excellent. We got another call on the line. Betty from Kanawha County. Betty, please ask us your question.
Yes, good evening. My brother was just recently diagnosed with prostate cancer. He's going to go ahead and have this surgery, but he was given an option of two other treatments that he could have, but he's real concerned and worried about it. I think it's something like a class 1, if that sounds familiar to you. Do you think that he should go ahead and just totally have the surgery done, or what would your options for that particular class 1 be? Or does that sound like it's something he needs to have done right away?
All right, which one would entail
it's
that?
It's hard to say specifically what would be recommended because we do not have your brother's records and we can't really see exactly all the details. But in general, prostate cancer can be cured with either surgery or radiation treatment. So I'm sure that his physician chose the right treatment for your brother.
Excellent. All right, radiation or surgery. Is there any other treatment for prostate cancer? Isn't there some sort of an oral therapy for some types or some stages of prostate cancer that's used as well?
If prostate cancer has spread to the bones, patients go on what we call hormonal therapy, where they get an injection about every 3 to 4 months, and they take a pill every day. It does not get rid of the cancer or kill the cancer. It just puts the cancer in remission. I like to tell my patients it puts the cancer asleep. And so the hormonal therapy is part of our treatment regimen for certain patients.
Got it. All right, we have another call on the line, Cecil from Marshall County. Cecil, ask us your question, please.
I've been having some problems, like in the morning when I have a bowel movement and I go to wipe. The pressure I apply on my rectum with the toilet tissue, it frees up a stream of urine just automatically. I don't know whether this is something to do with my prostate or what would be the cause of that.
Henry, I think we were talking a little bit about that earlier. Is it?
Yeah. I would tell you to go in to be evaluated and to be examined because it could be many different problems, and you definitely need to go in to be evaluated.
What kind of problems could it signify? What things would you be worried about?
It's a whole laundry list of things. It could be from minor to very major things. Very major problems such as rectal cancer or prostate cancer. It could be hemorrhoids. There's a lot of different problems that a man could have, and he needs to go in to be examined and evaluated.
Well, Cecil, sounds like you really need to get that checked. It may be something minor, but there are at least a couple of serious considerations too, so please check on that one. All right, tell me, I have something in my teasers today about too many multivitamins. How does that factor into prostate cancer?
So far that there is no protective measure against prostate cancer but changing your lifestyle. We can't change our genetic, of course, so the only measure would be changing our lifestyle. There has not been any simple agent that can protect against prostate cancer, though a lot of studies that highlight the selenium, the zinc, and vitamin E, and etc. But there is no evidence that any of them help against prostate cancer.
Are there any that can hurt, though? Can taking too many vitamins actually be bad for you? Or is that, am I wrong on that?
Well, of course, certain vitamins, the fat-soluble vitamins, can be toxic in very high amounts, such as vitamin A, vitamin D, vitamin E, vitamin K. Okay. So one has to be very careful as far as how many vitamins they're taking. And they should discuss this with their family physician, the supplements that they're taking, to be sure that they're taking a safe amount.
There's another problem that I know that can give you trouble with urination. That's not directly prostate cancer, but it's prostatitis. Can you tell me a little bit about prostatitis and what the symptoms of that would be as opposed to the other?
Yeah, prostatitis is an inflammation of the prostate gland, and usually it happens in young people, though we see it sometime in elderly people. Kind of inflammation can be caused by bacteria, or in many cases we cannot isolate some source of inflammation, but there is white blood cells like in their urine, but we cannot isolate a single factor to cause that inflammation.
Okay. We have another caller on the line. We have Guy from Putnam County. Guy, what's your question for us tonight?
Hello, Doc. Yes, my question is I've been diagnosed with a skin parasite, and we've been fighting it here for about a year, but it's migrated to my urethra. And I was just wondering what doctor should I be seeing, and what can I do in the meantime of getting an appointment with a doctor about this possibility of a parasite infecting that area.
Henry, your turn. What should you do about a skin parasite that infected his urethra?
Sounds like he needs to see a urologist and maybe have what we call a cystoscopic exam, where we use a telescope to look on the inside to evaluate his urethra and to give him a full evaluation.
Is that fairly urgent? Should do that pretty quick?
Well, I would say he probably should do it fairly quick.
All right, sir. I get that one checked on. That sounds like it's potentially serious. Thanks for your question. All right. I don't have any symptoms at all. Could I still have prostate cancer?
Oh, yes. Prostate cancer is known as the silent killer. A lot of men are walking around with prostate cancer, so that's why it's so important for screening to take place. And we advise all men over age 40 and 50 to get their prostates screened. Now, of course, older men 75 and above, we don't recommend that they go in for routine screening. But if they're having prostate problems, that they should still see their doctor or urologist.
Okay, and that is something I heard of called watchful waiting. What's that? Is that tied into what you're saying?
Watchful waiting refers to, in some patients with prostate cancer, especially if they're older patients and they have a lot of other medical problems, and we don't actually treat their prostate cancer, we watch it, and we call it watchful waiting. And those patients are still monitored about every 6 months with the PSA and their prostate examination. And a lot of those patients, we never really treat their prostate cancer, and they do not die of prostate cancer. So every patient is different, and what their best treatment should be, or the treatment option.
So the thing we've got going for us is that prostate cancer is pretty slow. Mohammed, there was another thing that you mentioned earlier about the robot, and I don't think we got into. The robot's used for the prostate surgery, but isn't there a new use for that Da Vinci robot for kidneys?
Yeah, we are using it right now for kidney and for a lot of other urological problems, like urethral reimplantation and many other diseases. We do, gynecologists also use it for hysterectomies. Cardiovascular surgeons also use it for CABG procedures. It's becoming more and more a good way to treat our surgical disease.
Excellent. So the robot just makes us more accurate, it sounds like. We have a caller on the line, Cleet from Wood County. Would you have a question for us, Cleet?
Oh, yes. About your treatments. Isn't there two more treatments, like you can freeze the prostate, or you can heat the prostate now?
Freezing and heating. How about that? Henry?
Yes, freezing, the cryoablation is an option. Some centers offer that, and in certain patients with localized prostate cancer, it can be curative in some patients. As far as the heating, we use that mainly for some patients with enlarged prostate and not for cancer, for BPH or enlarged prostate condition. That's one of the treatments that we use.
Excellent. So more than one way to treat it, for sure. Tell me about, as far as symptoms of prostate cancer, one of the ones I noticed in here was painful ejaculation. I hadn't heard of that one before. Is that common with?
Again, every patient is different, but some patients may have painful ejaculation. They may notice blood in their ejaculate. And of course, one should go in to be examined and evaluated if you have these symptoms.
Okay. I have another caller, William from Ohio County. William, what's your question for us tonight?
Yes, sir. I was diagnosed with prostate cancer. I'm 53 years old, and I had no symptoms whatsoever. The only way that I found out about this was with the blood test, the PSA test, from my family physician.
So how are you doing?
And I was just, well, I'm going to have surgery. That's my option because of my age.
Well, I'm glad they found it. Do you have a specific question for us about the treatment or that we could help you with?
Well, I was just curious. I mean, I had no symptoms whatsoever. And I mean, is that normal?
We discussed it a little bit earlier. We can certainly hit that again, but I think it's really common to actually have prostate cancer and have no symptoms. The benign hypertrophy is more likely to cause you the symptoms, but many people with cancer have none. Isn't that,
That's correct.
Am I correct?
That's
what
correct.
I thought you
That's why we call it the silent killer, because a lot of men have it and they don't know it. But someone in their 50s, like the caller, it's good to diagnose it early and for early treatment. He said he's going to have surgery and that, but good aggressive treatment.
Good. Well, William, we wish you the best of luck. I hope you have good luck with your surgery, and thanks for calling us. So you can have it with no symptoms. You can have lots of different kinds of symptoms. Basically, everybody needs to get screened, whether you think you need it or not, is what I'm hearing tonight.
I would agree with that.
We have a call from David in Marion County. David, would you like to ask us a question tonight? Please go ahead.
Yes, thank you. Is a blood test sufficient enough to screen for prostate cancer?
You mean a blood test without having the digital exam?
Yes.
Well, prostate screening consists of the PSA blood test and the prostate exam. One of these alone is not a screen. So one must have the prostate exam as well as the PSA blood test. I've had patients who had a normal PSA and they had a nodule on their prostate, which turned out to be cancer on biopsy. So again, screening consists of the prostate exam plus the PSA blood test.
Interesting, interesting. I had a question for you about, Mohammed, about Propecia, the drug that they use for hair loss. I understand that's basically the same drug that is used to treat benign prostatic hyperplasia, but at a lower dose. Does that interfere with your screening processes? And if somebody's going to use that, should they get a screening PSA? Do we know anything about that?
There's no clear data about it. It is still under focus, and people are looking at different people who take the Propecia for their hair loss, and they're looking at their PSA and they screen them, but there's no clear answer for that. The clear answer would be for the original drug, the Avadar or the Proscar, which the Propecia is like it, but with very smaller dose. With the Avadar, we tend to correct or multiply their PSA by 2 after evaluation. However, some study came up recently to show that Avadar and the Proscar has protective effect against some prostate cancer.
So it may be protective, but if you're taking it, it sounds like we need to tell our doctor that you're taking the Propecia just in case it's a confounding variable. You should know.
Absolutely.
Perfect, perfect. So urination problems don't necessarily mean prostate cancer. No symptoms don't necessarily mean you have no cancer. Everybody needs to get screened. Screened at 40 if you have a family history, 50 if you don't have a family history. Is there any other thing that we missed tonight that you'd like to, final parting thing, Henry, you'd like everybody to remember?
Well, I would recommend that all men get screened and do it once a year and don't skip a year and see their family doctors or urologists and be screened.
Great. Well, yeah, a few seconds left, but is there anything that you can do with diet, with smoking matter, anything that we can do healthy-wise to prevent prostate cancer?
generally speaking, having a healthy diet, high fiber diet, and low in fat and low in protein is basically very healthy for not only for prostate health. Actually, it's healthy for cardiovascular disease. It's healthy for colon cancer. So this is general recommendation.
General. Super, very good advice. Well, we've been talking tonight about prostate problems with Dr. Henry Fuchs and Dr. Mohammed Salkini. Thank you both for being with us. If you'd like more information, see your family doctor or visit our website at wvuhealth.com. For Doctors on Call, I'm Dr. Joe Prudhomme. Good night and good health.
Join us again next week for another edition of Doctors on Call. For Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
This has been a production of West Virginia Public Broadcasting.